Hello, everyone. I'm Dr. Rachel, an endocrinologist. Today, I invite you to join me in exploring a very important topic: the warning signs of diabetes in the elderly. Did you know that more than 60% of seniors have diabetes without even knowing it? They still walk every morning, eat moderately, but silently live with this chronic disease until dangerous complications strike. In today's video, let's identify the early signs, both obvious and silent, of diabetes, especially in the elderly. Don't miss it, because if you recognize it early, you can reverse the disease process. As we age, our bodies don't metabolize sugar as well as they used to. The pancreas reduces insulin production and cells become resistant to insulin, meaning that even with insulin, sugar can't get into the cells to produce energy. This causes blood sugar levels to gradually rise. Combined with lack of exercise, a high-carb diet, or the use of medications to treat underlying conditions, all contribute to an increased risk of diabetes in older people. Ladies and gentlemen, diabetes in the elderly often progresses silently but leaves quite clear signs. If we pay close attention, we can completely detect it early for timely intervention. Sign 1: constant thirst, but still dry mouth. Do your grandparents often complain of being thirsty all day, even though they just drank water? You may think it's because of the weather, but that's the first and most common sign of diabetes. When blood sugar levels are too high, the body tries to get rid of it through urine, leading to dehydration. And strangely enough, the more water you drink, the more dry mouth you feel. Sign 2: frequent urination, especially at night. Do you notice that your loved one has to get up 2, 3, or even 4 times a night to go to the bathroom? This not only disrupts sleep, but is also a warning sign of a sugar metabolism disorder. The body wants to eliminate excess glucose, and the kidneys have to work overtime, causing the patient to urinate frequently, even without drinking too much water. High blood sugar, 100 mmHg/dL, will exceed the absorption threshold in the kidneys, causing frequent urination, glycosuria. Sign 3: unexplained weight loss, silent and dangerous. This is a dangerous sign because it happens very silently. Elderly people eat normally, even eat more, but lose 2 or 5 kilos within 1-2 months. That is when the body cannot use glucose for energy, so it burns fat and muscle to compensate, causing weight to plummet. Sign 4: constant fatigue, despite adequate rest. People with diabetes often complain that they are always tired, even when they are not doing anything strenuous. Why? Because their cells are starved for energy. There is an excess of glucose in the blood, but it cannot enter the cells due to a lack of insulin or insulin resistance. As a result, the body is constantly running on gas. You can think of it like a car full of gas, but the fuel line is clogged. Sign 5: slow healing wounds, a warning of a weakened immune system. In healthy people, minor scratches will heal in 2-3 days. But if your grandparents scratch their hands while cooking, or have a minor impact that causes swelling, oozing, or slow healing, be careful. Diabetes reduces blood circulation, damages peripheral nerves, and weakens the immune system, leading to very slow wound healing. Slow healing wounds are also the cause of diabetic foot ulcers, a dangerous complication that can lead to amputation. These 5 signs are not just warnings of old age, but the whispers of a silent disease. If you or a loved one has 2 or more signs, don't hesitate. Get your blood sugar checked early. Early detection is the first step to protecting your health and avoiding dangerous complications later on. Hello, everyone. In addition to the obvious signs, diabetes in the elderly also has many hidden symptoms that are easily overlooked. These signs are often confused with natural signs of aging, causing many people to not think about going to the doctor early. 1. Blurred vision, especially with changes in light. One of the quietest but most common signs of diabetes is vision changes. Older people often say, "My vision is blurry, it must be because I'm getting older." But in fact, high blood sugar can cause the lens of the eye to swell and lose its ability to adjust to light. They may have blurred vision in the sun or see text that is blurry when reading, even though they have just had their eyes examined. Long-term diabetes can cause damage to the retina, called diabetic retinopathy, a leading cause of blindness in older people. 2. Itchy skin, dry skin, susceptible to skin fungus. Have you noticed your grandparents scratching their hands and feet, especially at night? Itching without a clear cause can be a sign of diabetes. When blood sugar is high, the skin becomes dehydrated, the oil glands are less active, the skin becomes dry, easily cracked and infected. Especially in the groin, armpits, between the fingers, very susceptible to dermatitis, diaper rash, and fungal infections. Candida thrives when blood sugar is high, easily causing vaginitis, diaper rash, skin ulcers in moist areas. 3. Numbness and tingling in the fingertips and toes, thought to be degeneration. Many people think that the feeling of numbness, tingling, and burning in the hands and feet is due to spinal degeneration, but it is also a very common symptom of peripheral neuropathy due to diabetes. When blood sugar is high for a long time, small nerves are damaged, abnormal sensation, even loss of sensation. Diabetic neuropathy can cause the patient to not feel wounds on the feet, leading to ulcers that take a long time to heal. 4. Breath smells strange, sweet like fruit or slightly foul. This is a less expected sign. Breath smells strange, sometimes like ripe fruit or unpleasantly pungent. When the body cannot use glucose, it switches to burning fat for energy. This process creates ketones, an acidic substance with a characteristic smell. Breath that smells like ketones can be an early sign of ketoacidosis, a dangerous complication of diabetes. 5. Mood changes, irritability, or depression. A subtle but real sign, a change in temperament. People with diabetes may feel irritable, sad, or lack motivation. Why? Because blood sugar levels directly affect the brain, causing an imbalance in neurotransmitters like serotonin and dopamine. If your husband often yells at you when the house is not tidy, or your wife sits around all day, don't just chalk it up to aging. It could be a silent warning from your body. You see, there are signs that are painless, but can change your entire quality of life. Don't let them be ignored because you think it's just old age. In the next section, we'll share how to recognize early and identify diabetes risk in an easy-to-understand way. You definitely shouldn't miss it. Dear all, as we enter our later years, proactive diabetes screening not only helps control the disease, but also prevents dangerous complications such as stroke, blindness, or kidney failure. Here are effective ways to help detect early and get appropriate testing for the elderly. 1. Listen to your body every day. Older people need to listen to their bodies by observing small changes. Has there been a change in their diet? Are they often thirsty or urinating at night? This helps detect early signs of abnormalities, the first step to protecting their health. 2. Check your blood sugar at home. You should have a blood sugar meter at home. Measure when fasting, before breakfast, 2 hours after eating, and before going to bed. If the index is abnormally high, for example, fasting blood sugar above 7.0 beta-mol/L, you need to see a doctor immediately. 3. Regular general health checkups, at least twice a year. Especially for people age 60 and over, regular health checkups every 6 months are essential. Including blood sugar, blood lipids, kidney function, and blood pressure tests help screen for many chronic diseases. 4. Do the HbA1c test. Measure average blood sugar over 3 months. This is a very important test because it shows the average blood sugar level over the last 3 months, unlike on-site measurement, which only reflects temporarily. If HbA1c is 6.5% or higher, you may have diabetes. 5. Monitor your weight and waist size regularly. Diabetes is often linked to abdominal obesity, so if your waist size exceeds 80 cm in women and 90 cm in men, you should take note. Unexplained weight loss is also a warning sign, so don't ignore it. 6. Keep a health diary. Recording indicators, blood pressure, blood sugar, number of times urinating, feeling during the day, helps the doctor have more information to diagnose. The old lady can use a notebook or a simple app on the phone. Early detection of diabetes is not difficult. Just listen to your body, check regularly, and go to the doctor at the right time. If you have 2 or more signs or abnormal blood sugar levels, do not hesitate. Early detection can help us live healthy and long with our children and grandchildren. Dear friends, diabetes in the elderly is not the end of a healthy life. The most important thing is that we recognize the signs in time, including the silent signs that are easily overlooked. And as you saw in today's video, regular health checkups, blood sugar monitoring, and listening to our bodies will help us detect the disease very early, even before dangerous complications occur. But detecting the disease is only the first step. How to control blood sugar well? How to eat, exercise, and take medication properly when you are old? These questions will be answered in detail in the video. How to prevent and manage diabetes in the elderly will be released in the next video on the Wise Health channel. Don't forget to subscribe, turn on the notification bell, and share the video if you find the content useful for yourself or your loved ones. I'm Dr. Rachel, wishing you good health and happiness, and see you in the next Wise Health video.